Thank you much, Dama, and thank you to all of our speakers for giving us such a fantastic overview of the research of the Hub. So I'm Vice Principal for Research and Innovation at RVC. Fantastic to see you all here. And so as VPR, I've kind of experienced the Hub mainly as a research project. And it's possibly one of the largest, most complex and most international research projects that the RVC has ever undertaken. And before introducing our panelists, I just want to pay tribute and express the RVC's thanks to everyone involved in making the Hub one of the most successful projects we've ever had. In particular, I'd like to thank Professor Tomley, who's not with us today, for her exceptional leadership of the Hub project, which has faced a number of very difficult adverse circumstances, and she has brought it to such a fantastic conclusion. And there is, of course, much great work still to come. I'd like to thank all of the researchers who have been involved in the project, some but not, only a few of whom are with us in the room today. And thirdly, I'd like to thank some of the perhaps unsung heroes, the support staff at this institution and at institutions around the world who might be technicians or their administrators or their people involved in the management of international partnerships. And all of those people have helped make the Hub happen too. Okay, on to my main duty, which is to extend a very warm welcome to our four panellists and our moderator. And together they're world-leading experts in the fields of public health medicine, food systems, farming, conservation, sustainable development, and governmental and international policy. And together they're going to discuss the topic Future Priorities for One Health and Global Food Systems. So our four panellists are, from right to left, at the bottom here, Professor David Heyman, who is a public health physician and Professor of Infectious Disease Epidemiology at the London School of Hygiene and Tropical Medicine. David's also a super timing, thank you. Professor's also a distinguished fellow at Chatham House, and before that he was chair of Public Health England and has decades of experience at the World Health Organization. Next we have Professor Steve Hinchliffe. Steve is a social scientist with expertise in food, farming and technology. He's based at the Department of Geography at the University of Exeter, where he previously directed the Wellcome Centre for Cultures and Environments of Health. Professor Melissa Leach. Professor Leach is Executive Director of the Cambridge Conservation Initiative, a unique collaboration at the University of Cambridge that includes 10 leading biodiversity organisations. She was previously Director of the Institute of Development Studies at the University of Sussex. And our last panellist, familiar to many of us here at this institution, is Dr. Christine Middlemiss, who is the UK's Chief Veterinary Officer, based at the Christine's based at the Department of Environment, Food and Rural Affairs, and before taking up her post in 2017 as CVO, she worked on developing policy solutions to detect and respond to emerging animal disease risks. And lastly, I'm delighted to introduce our discussion moderator, who you've already met, Professor Robyn Alders. Professor Alders originally trained as a vet and is now recognised for her work worldwide on food security and poultry health in developing countries. She's a senior fellow at Chatham House and also holds an honorary professorship here at the RVC. So thank you very much for stepping in at short notice, Robyn, and over to you.
Thank you very much. And clearly, it should be Fiona here. We'll do the best we can. And I'd like to echo Stuart's comments, as we all would in the Hub, to thank Fiona for her amazing work over the past 7 years, and it's not done yet. I'd like to just run through some housekeeping notes to explain how the session is going to work. It is going to last 1 hour, this panel. These incredibly busy people, some of them are not done tonight, so after they finish here, we do need to finish promptly at 6:45 so that they can go on to other commitments. The event is being recorded and it's going to be available on the One Health Poultry Hub afterwards for your viewing pleasure. We do want this to be an interactive discussion, so as they talk, we want you to think about questions, be ready to ask when the Q&A sessions come. For those of you in the room, please just raise your hand if you have a question. If you're watching online, post your question in the Q&A function and I will be notified that it's there. We will try to accommodate as many questions as possible, and if time doesn't permit, for those of you who are staying on and for some of the panellists who are able to stay on, you may have a chance at the reception. Otherwise, I'm going to apologise if we can't accommodate all of the questions. So, with that, let's get underway. I'm going to ask one question and then ask each of the panellists to respond, and they're just going to pass from one to the other to reduce my interruptions during the session. So the first question to the panel is, the Hub used a structured interdisciplinary One Health approach to address defined but complex questions relating to the sustainability of poultry production systems. So the question is, do you think this is a valuable approach, and could aspects of what we have done be beneficial to future food systems oriented initiatives? Over to you, David.
Thanks, Robyn. It's a real pleasure to be with you, and I'm sorry I walked in late, especially late. Anyway, you know, the vets really get the whole issue of food safety, food security, and zoonotic infections. The public health doctors are beginning to understand it, and the clinicians don't understand it at all. So with an evidence base such as you've collected in this project, you can really influence those clinicians who today only become aware of threats to the food system if there's an outbreak of salmonella or if their patients become sick from a food product. So it's very important that people work together to really understand. I noticed in the networks that Guillaume showed, there were not very many human doctors involved. It was mainly industry and veterinarians. They understand the issues. The public health community needs to become more involved, and I know you're doing that in Bangladesh and in many other countries. But thanks, Robyn. I'm going to turn over to my colleague.
Well, likewise, I'm delighted to be here, and every time I hear, I've heard some of the speakers before, and I learn something every time, and it's really, really valuable. Of course, it's an important approach, and that people should be learning from this hub. I have a number of issues with One Health. One of the issues is not, of course, that we need that integrated approach, and we need the combination of health systems, animal production systems, and environment, and so on. That to me is very clear. I think one thing that's coming through the work and the papers that I've been reading from the work is it's not, One Health doesn't mean one size fits all. Right? There's quite a complicated world out there of informal networks, of different ways of farming, different species, different risks. It's not just the perception of those risks, but I think there are different risks being faced in those systems. And I guess the real tension for me going forward is, how do we we need a One Health system. We all live on the same planet. We share the same diseases, the same the viruses circulate very quickly. But we also have quite complex systems and food systems where we need to take seriously the social, economic, viral, and different kinds of organizations involved. And I think that's a real issue. How do you standardize across that system when you've got quite radical difference, if you like? It's not everywhere has to become like the UK poultry system. That can't work and won't work. So I think that's a real tension in this work, and something that we collectively need to do more about.
Thanks. Well, picking up from those points, I mean, it's, again, an absolute pleasure to be here, and what a long way the One Health Poultry Hub has come. I remember it right at the beginning when colleagues in IDS were helping it to get going, and what a lot you've all achieved. So it's fantastic. And I totally agree. I mean, this is an exemplar. This was the kind of approach that was needed, is needed to understand challenges like this, but also, to pick up the other part of the question, for wider aspects of food system transformation more generally, which we absolutely need, because global food systems at all levels and of all kinds are thoroughly unsustainable and inequitable. So the couple of things I'd want to pick up as well. As Steve said and David said, One Health is about integration and collaboration, partly across sectors, and that's the way it was set up, bringing together environmental health, human health, animal health. But it's also about disciplines, and I think one of the real achievements of this programme has been the way that it's brought technical scientists, virologists, molecular biologists, public health people, clinical scientists together, also with social scientists. And I want to make a bit of a plea for why I think that's been so important. So often the social sciences are an afterthought. It's kind of brought in a little bit at that level to explain a few behavioural factors that can get the interventions right. And I think what's been evident in this programme is that the social perspectives are far more than that. And we saw it just in the presentations just now. It's been about understanding context, those very, very different contexts. It's been seeing that the drivers of problems and therefore the routes to solutions are often structural. They lie in things like political economy, the structures of economic systems and markets. But it's also crucially been about understanding different perspectives through interviews, through engaged discussions, focus groups, participatory methods, to see how different farmers, people working in slaughterhouses, people in markets, women and men, people from different class backgrounds, different ethnic backgrounds, have very different views of what the problem is and what the solution might be. So I think it's been that's been really vital. And if we're to move forward, I think a lot of the work on One Health is not just about looking at sustainable systems into the future. They also have to be equitable ones. And putting that equity element into One Health and into food systems transformation, I think, is vital. And this hub has begun to show the way to do that.
So equally pleased to be here and blown away to be in such an esteemed panel, and to have followed and been a little part of the journey of the Poultry Hub, which has done such fantastic things and really made us think, I think, about our approaches to things, and that leads into this question. And David started his answer by saying he thinks that vets have this good understanding of the links to people, and for me that comes from when I was, I think, even a vet student still at school seeing practice. And a wise vet said to me, Christine, every animal you ever see will be attached to a person. It doesn't matter how good a vet you are, if you can't do the communication and work with that person, you won't be being very effective. But I guess thinking about it the other way around, that's not quite the same. Maybe for our human colleagues, thinking about the link back to animals. And so we have a real role as vets, I think, in amplifying that and linking very much to the human behaviour aspects and the social behaviour. What drives people to take the actions they do, and how will those change? And so the value for me about this approach, being structured and interdisciplinary from a government perspective, is having done it through the research and presenting these joined up conclusions and findings. Because if you're not doing it in the research, we end up doing it ourselves, and we're not the right people in government as policymakers necessary to be doing that and drawing the right conclusions. And so for me, coming out those conclusions that are One Health, thinking about the system, are really, really valuable, way more than, because this problem's still there, government's still thinking about how do I address this problem, but rather than, and we've moved on a long way, with focus groups and trying to co-design policy, but to have evidence presented and analysed in this way is just so very valuable. Thank you.
Thank you. Dan reminded me that I forgot to remind you is that the microphones are a long way away from you. So if you can lean forward, lean in, is what we're going to ask. Before we go to questions from the floor, do any of the panellists want to ask each other a question?
Thanks, Robyn. I don't want to ask a question, but I want to talk about a meeting that was held at Chatham House in 2009 with people from around the world trying to understand how to really operationalize One Health. And one of the recommendations of that meeting has always stuck with me. It was that this should become a movement like the Red Cross and Red Crescent societies. And it should start in the community, where communities have access to knowledge and information about food safety or about any issue related to human and animal health. And then it moves upwards into the government. And I think we often forget that communities are really where all this begins. And communities now have apps, they have things that they can use to report what's going on and to obtain information. So I just wanted to add that in thinking as to what people were saying, and maybe some of the other panel has some ideas on that as well, Robyn.
Well, I'm really pleased that David said that, and I come from a background as an anthropologist, someone who's always worked closely with communities, and I would 100% agree. But also, of course, the kind of integration that One Health has striven for in the tripartite and the quadripartite and these big policy debates is lived every day by the communities we've just been hearing about. People don't separate their lives from the lives of their animals. They often, in many societies, they understand them as very, very, very interconnected. And certainly the questions of health and of animals and people, and I would add of the ecology and the environments around, which has been in some ways a bit of a latecomer, I think, to the One Health Party. I mean, to the addition of UNEP at the global level has, I think, really tried to put an ecological and an environmental plank and brought questions of biodiversity and conservation, which are now something that's very much occupying me, to the fore. But of course, all of those things have always been integrated in the lives and livelihoods of the communities that we're working with. And I think that's often why it's a good place to start, actually.
Thank you very much. So now time for our colleagues from the floor. Thank you, Eve. The microphone's coming. Yes.
Hi. Thanks very much. It's been really interesting hearing everything come together that I know a lot of us have been kind of working in bubbles on, and seeing it all come together is really nice. And
microphone needs to be.
Oh, sorry.
Yeah.
The hub. I want to come back to a point that has kind of been hinted at by some, and also directly you spoke to it, Robyn, about time, which is that we've been working on the hub in various ways for a long period. It's been running for 5 years, and we found out it's been in the minds of many for many years before that. And I guess I'm curious now, seeing everything coming together and on other projects like this, how the panel feels about translation of the evidence that this kind of work produces into positive change, which I guess is the motivation for so many of us coming into these kind of projects. What it is that can be done by, whether that's the scientists themselves or funding bodies or government bodies, to kind of translate evidence into positive change, and whether anyone had thoughts on that. Thanks.
And Eve, sorry, I forgot. Could you just introduce yourself and who you're with?
I'm Eve Horton. I'm a social scientist at the RVC. Yeah.
Thank you. So who on the panel would like to respond to Eve's, or whom?
I'm happy. Well, it's a great question, and of course, what every project faces. I think there's a difficulty. This is an invitation from me, is to rethink the metaphor and whether translation's the right term. Sometimes translate. I think Tricia Greenhow wrote a great paper 10, 15 years ago about the difficulty of translational medicine and the different models and so on of going from, lab to bench to bedside, etc. And there's an awful lot of thinking that's being done around translation. My thought when I'm hearing about examples of what farmers are doing in Vietnam, the informal networks or complex networks in Bangladesh, is that translation is a difficult thing to get through all those kinds of routes or routines. And what this hub, I think, has highlighted to me is that this isn't about translation from a centre outwards. This is about building communities. It's almost going back to the social movement issue, is how do you continue to build relationships where people can find the right solutions in their context that nonetheless do work across those contexts and so on. I'm not arguing that there's a thousand flowers can bloom here, but there are ways, I think, of using a hub structure to push this forward. And I'm just wondering whether translation is the right metaphor for what you want to maximise the value of what's been created here.
Anyone else?
I'll have a go. I always find this question really hard, and that's coming kind of from the, being inside and influencing policy, because our minds are usually, and given often the short-termism of government, focused on the short-term next questions, and the linking up to, other than the scientists generally that we work with directly in our organisations or affiliated, like for me, Pirbright things, we're not having those conversations enough, I think, about our, in terms of potential policy down the road, and that join up with risks and horizon scanning. I don't, in my world, see enough of it. That join up, and I really struggle to understand and to advise better, not understand, but to advise how better to do the translation.
Yeah, I'd just add that many times the evidence is there, and the political leaders decide to create a regulation rather than using the evidence to create sound policies. And I often remember an example in China after the SARS outbreak in 2003, which some of you will remember. After that outbreak, there was research done in China that showed that their animal farms were contaminated with coronaviruses. This is the wild animal farming, contaminated with coronavirus. They also showed that market workers had a 12% level of prevalence of antibody to coronavirus, yet the populations they served had a lower level at 3%. They had all this information. They knew exactly what was going on. Yet what they did was made a regulation that closed all the animal markets. And all that did was drive the market underground. As we know, that's what happens when these things occur. So it's very important with the policy not to let the policymakers get away with the simple, what they think is the simple solution, regulation, but get them to use the information to really make sound policies, such as educating the communities and the market workers.
Yeah, I think these are great points. I've always, sort of to build on them, always had a problem with the notion of translation because it's so linear. It sort of implies that all the science happens over here, and then there's some point at which it all gets added up and translated. And I think that gives us both a false view of actually how the process happens in practice, and also presents kind of policy as if it was this kind of unified thing, as if all these decision makers were just sort of sitting there waiting for the evidence. What I think the One Health Poultry Hub shows us, and it was evident already in some of the cases, is that there's a much more dynamic process already going on, which is much more interactive from the beginning. If you like, it's slightly more co-designed, or to use that other phrase, sort of transdisciplinary. In a way, I think we've seen in many of the different countries, policymakers, different stakeholders, whether they're those organising markets, farmers, all involved throughout. And I think many of the researchers have been interacting with those stakeholders throughout. So you get a much more dynamic process of engaged research and interaction. And I would hazard that some of the kind of impacts on decisions at lots of different levels actually have happened already in the course of what we've seen. And I think some of those very nice examples of impact show that. And they were sort of kind of interim impacts on the ways people were thinking and acting, which add up to a slightly different kind of view. I think the other thing is that over a 5-year process, things change, and it was probably never going to be sensible to establish a kind of blueprint at the start for the science and then deliver it to policy. You've actually had a period where in all the countries at stake, there have been ongoing debates, the economy's been changing, the production statistics have been going up, as we saw at the beginning. And that's created a context which has probably required adaptation and learning by doing as one goes through. And maybe those are some of the lessons that can be generated from this programme. Not about how to do translation, but why translation's not the right metaphor and why we need to be thinking about a more interactive, sort of transdisciplinary kind of approach.
Thank you. That was a fabulous range. We've got Brian, and then we'll come down to Emma.
Thank you. Thank you very much. My name is Brian Perry from the Gender Institute in Oxford and also from the University of Edinburgh. First of all, I want to say what a wonderful program this has been, the Hub has been, and what beautiful presentations there were, how well they were put over, and with such detail and excellent, well done that. I've got a couple of questions for you. The first is, because I have more of an Africa focus, now in Africa at the moment, and next week there is the One Health, Global One Health going to occur in Cape Town. In Africa there are at the moment a whole lot of initiatives to try to establish One Health in various countries. For example, there is COHISA, which is funded by the European Union, but there are also, there are 7 of them. I know Afrique One, Afrohun, Gohi, Ohio State. So there are several of them. One of the objectives, the main objectives of those, is number one, institutionalization of the One Health, which you haven't really. You have focused on food systems, and within the food systems on poultry. So my first question is, where next? Are you going to look at small ruminants in Africa or Asia or something? Is there a model that you can then move on your food systems? The other point is the objective is not only institutionalization, but it's also capacity building. Capacity building under that broad umbrella of many of the issues that you've raised in terms of One Health. So my first question is, where next? And the other question that I haven't heard addressed is, what about welfare? So the welfare topic hasn't really come up in the discussion so far, and I've just been asked to contribute to a paper on welfare and SDG 1, and I'm struggling with it. Thank you very much.
Excellent economy, Brian. 1 microphone, 3 questions. But each of them extremely important. So let's work our way through them. Who'd like to start? We've got the where next, institutionalisation of One Health, and then the very important issue of welfare. And I guess that's not only animal welfare, but one welfare, is it? Or yes?
I can't possibly do justice to all 3, and it's also slightly strange because obviously I'm not part of the hub. And, but the institutionalisation question is a really important one, and I think one person to look at there would be Sarah Cleveland's work in Tanzania and so on rabies. One of the really interesting things she arose from that work was the different costs and benefits of One Health across different departments. So, for example, the Department of Health are clearly the ones who are going to benefit from inoculating the wild dogs or the feral dogs, and yet the cost will fall on the veterinary department to do that work. So it's a good example of how you need that joined-up government. A really difficult issue, not wholly solved, I think, through the form of economic tools that she suggests. But anyway, that's really useful. One Welfare, I think, is really important. And I was not going to raise all my problems with One Health, but I think the word health and welfare are such vast terms that we sometimes get into that trap of treating One Health as keeping pathogens out. Clearly, health is a lot more, as we know from the WHO. It's not the absence of disease. Health is a much more interesting and important topic in animal and human realms, which includes, of course, welfare. So we need to think seriously about that. I guess the last point I'd like to make about that, I think One Health also involves a number of trade-offs. And there's some great work thinking about animal welfare over the years that, optimizing that is not always the answer within livestock systems. And we need those kinds of economists to think about what are the trade-offs, what's enough welfare at particular levels of food security and so on. These are really difficult questions, but I think really important ones.
Mm-hmm. We have around 6 minutes to go with this particular Q&A session, and at least one more question. Does anyone else want to give a response to the points raised by Brian?
Yeah, I would just say that I think the UK government, with its HARES initiative, has really been able to institutionalize One Health, and maybe you'd speak more about that.
Well, it has. So HARES is the Human Animal Infectious Risk Surveillance Group. And how it works, so it's a combined group, and it's a UK-wide group. So it has public health colleagues and animal health colleagues. It's currently chaired by an animal health risk expert. Comes together every month, and we bring up through our risk observation system. So we bring zoonotic disease risks coming from animals, and our public health colleagues bring things. Zoonotic disease risk that they've heard about and seen from their perspective, and you come together to discuss them and assess them. The group doesn't own the responses, but that then comes back to the policy teams, and it is really effective in getting that joined up and balanced assessment of what the actual risk is, how it would act, and therefore potential actions. And they publish much of their stuff. So they have published on the risk of the H5N1 in dairy cattle in the US to UK health, COVID, a whole lot of different things. So it is a very effective system from that perspective. But I think we still struggle to turn it into policy. I think we still struggle in a One Health way to turn it into policy. And so the question about institutionalisation of One Health fascinates me. Yeah. Should we bring, our disciplines together in a policy space? That might give the animal side more funding. Yeah. Would it become all about human health and less about animal health? I think there's some real knotty questions there for us to think about in that. Welcome others' views.
In terms of yes, please go ahead.
Just jump in there. Yes, just on this similar point. I think that is one of the challenges that the various kind of groups or sort of stakeholder groups that have been part of One Health are not equal. There are power dynamics between them which work out in different ways in different contexts. And I think actually one of the important aspects of the broad One Health framework has been that it has given power to vets, relatively speaking, in policy spaces, in research, in relation to perhaps the human health sciences, which were quite dominant. And I remember a program that we were involved in on dynamic drivers of disease in Africa, which did a big network mapping of stakeholders' interests in One Health, and really found that many of the veterinary scientists and policymakers felt quite empowered through a One Health approach to be able to play that part in those deliberative policy debates in a way that they hadn't before. So I think that is an opportunity. I think we really do need more of this kind of systems-based, interdisciplinary, research policy engaged work. This One Health Poultry Hub had some important precursors, such as the ZELS programs, the Zoonotic Diseases and Emerging Livestock Systems program, which worked on pig diseases and other things. There was a program that some of us in this room were involved in on drivers of disease in African settings. There are others emerging from this. Again, there's been the Myanmar Pig Project. There are some really interesting new systems-based approaches emerging. And I think if we can actually generate more of these, they need funding, they need attention, they need support. But I think they can also learn from each other, both in terms of the policy environments in different countries and what it takes to institutionalise in the UK, in Asian countries, in African countries, and also from what's gradually been learned about what it takes to do this well and to really get to grips with those tensions and trade-offs, as well as the opportunities of collaboration.
Excellent. I still have one more question that I'm going to put to the panel, but before I do put the question, Emma, would you like to ask your question and then...
Thank you. Emma Ross from Chatham House. Talking about policy space and it's got to be a movement and the power dynamics. I just wondered what you all thought of to what extent are the interests of the various stakeholders in One Health, are they really aligned? What is the interest, the common interest there? To what extent are economic interests, commercial interests, other priorities of government that health may not be, or even One Health may not be the top priority when we're talking about making policy? What do you think is the alignment of interests and what's getting in the way of this being more successful in implementing?
Fabulous question. Who would like to start?
So I'm reflecting back, if we think about the BSE, when we had it in the UK, and at that point, food safety was also part of the Ministry of Agriculture. And one of the learnings from that was to split it out and make it non-ministerial and make it not part of the same people who were also thinking not just about animal health, but about trade and agricultural development and things, because you can have because it has unintended consequences of it. So I think it really depends on the context at the time and the political drivers, and what governments want to achieve, then how they set up those sort of governance dynamics, and the messaging, and then the funding flows that come down through departments. The funding flows and spending reviews are really important in that context. I'm not sure we reflect enough on lessons that we have learnt and look at different systems in that way.
Yeah. I would throw in, well, absolutely agreeing with that. I think we also have to really recognise that there are big political economies at play here, and the agri-food industry in all its guises, but at a global level, so highly concentrated with so much about the food systems, the inputs to supply chains, trading networks being dominated by ever-decreasing numbers of very, very large firms that are becoming more and more concentrated. And they have unrivaled, disproportionate power in debates about food systems, including those about One Health. And that operates globally, often over and above what national jurisdictions can do, but also have influence on the room for manoeuvre for national policymakers, who are also having to think about the economies of their countries and their trade and securing food for populations, which is super important for making that contract between states and citizens. So there's a kind of global systems complex and the corporate drivers in it, which I think we can't get away from. And one of the things I think is quite interesting is whether One Health can begin to drive and support some of the alternative movements around food systems and food equity, which are based on well-being for people and animals, greater equity. And actually there are roles there again for transnational kinds of movements, maybe bringing together smallholders, food sovereignty and so on, in relation to some of those really big corporate players. So I think absolutely there's a national jurisdiction and governance set of questions which will be handled differently in different places. But there's also a global system element which is really pretty powerful.
I'll be quick. When Melissa and I met earlier, we said there's a risk that we're going to say the same thing. But I think there is something really important here, is that like other terms, sustainability, etc., there's always a danger of it being used to wash practices in particular ways. And one of the key issues around governance of food systems and welfare and so on at the moment is the rise of private equity firms, funders and so on, and investors in these large corporates who are relying on particular metric forms of what counts as animal welfare, health and so on. They don't canon add up to what a vet might think is animal welfare or health or anything else. There's the normalisation of health through a specific set of metrics. And I think there's a real danger that One Health gets repackaged as a kind of global, that was my problem with the one bit, not that it's not integrated, but it becomes one thing that then gets sort of, put on an account book, basically, and ticked off as a kind of procedure that, is just something that's ticked off, a bit like herd health plans became. Yes. So there are issues there, and I think the economic power is shifting away from nation states to some of these practices of financing and so on that we need to be really careful about. My sense of the One Poultry Hub is that it started to raise the kind of granularity and so on of what counts as One Health, and that's what we really need to hold on to.
And I just add one more issue, and that is that we have to be very careful with our global governance and our global recommendations to be sure they have a decolonization approach. Because what we see is, for example, in the antimicrobial resistance plan that the quadripartite now is promoting, there are issues related to food safety in all sectors. Yet there are interventions which can only be done in some sectors and not in others, or in some governments and not in other governments. So it's very important that there be an approach that finds the common ground that everyone can participate in, because if not, there will be issues such as inability to obtain antibiotics because there's need to test the animals or humans first, and a whole series of things that will increase mortality and in the end not benefit public health. So there needs to be a decolonized approach, and I have to say that because I come from the London School where that's our major emphasis. Thanks.
Thank you so much. As I mentioned, I'm going to put one more question to the panel. They'll have a chance to respond, and then we'll have a second Q&A. So do keep those questions that are in your mind. Keep them there. You will have a chance. So the second question that I'd like to put to the panel is that, in your view, what are the most urgent and important challenges we face in trying to ensure that the One Health paradigm becomes normalised and fully functional at technical, social and institutional levels? So building on some of your comments already. So over to you, David.
Thanks, Robyn. Well, what I've learned from you in working with you over the past several years is that it's both a communicable disease and a non-communicable disease issue. Food is important for both. And therefore, we have to have systems which encompass both non-communicable disease and communicable disease in humans, with food safety and food security, and also good, healthy foods. So I think that what we need is, and I'm not going to answer this very clearly, but I think what we need is to all eat more nutritious and safe food. And to do that, we need to make demands on industry, on our governments, on whoever we can make those demands so that we get what we need, and that is safe and healthy food.
I think I've used all my best lines already. But maybe there's just one issue that I'd like to raise, is that I've been on lots of farms in Asia and the UK where I've been told that there's a One Health approach, or that, you know, that's working. Sometimes the boundaries of that analysis around the farm border, and they just say we've got good systems for stopping pathogens crossing over into our populations and so on. My response sometimes is that, well, there's a risk you're just polishing firewood in these cases, because it's going to come whatever you do. But anyway, that's another story. But I really do think that if we're going to think about questions like biosecurity and its relation to One Health, we need to take a much broader spatial sweep. The poultry farms in the Wye Valley, for example, at the moment would all say they're doing very good pathogen control and so on, and yet you've got the absolute destruction of a river system, largely because there's waste coming out of those farms. You've got nitrate, phosphate pollution and so on, which may have an effect on wild bird populations and where they go and where they kind of roost and so on. You know, all these kinds of things start changing the infective pressure on the landscape, I think. So I think we need to start using One Health to kind of broaden the spatiality of how we think about these issues, away from single premise farms to thinking about broader landscape levels and disease preparedness and so on.
So coming on down the line, at risk of saying the same things as Steve, I was going to say something along those lines, but I think another route to normalisation is to, as it were, start from the bottom up. I mean, as we said earlier, many people, farmers, people involved in food markets, consumers, all of us, all of the citizens in the countries in Asia and Africa, essentially live One Health in their everyday lives. And if we were to make sure that research and policy making starts with and ends with citizen engagement and the kinds of deliberative panels or participatory approaches that are understanding those lived experiences, we'd begin to get a long way towards normalisation. I mean, if you normalise inclusion of people who are already living One Health in their everyday lives, that's part of the normalisation into governance. Not the whole thing, but can help, I think.
And for me, I think continued challenges to focus on where risk is created and not creating it and managing it, rather than focusing always on the outcome and managing the outcome. That's one. Yeah. And the other, it's come back to a point we've made several times, funding and systems. Give funding to the system, which we've seen through the Poultry Hub, rather than in silos to animals, environment. It's a bit like we were saying about farmers thinking about biosecurity just about their perimeter, which absolutely do, and not the slightly wider. We need to then fund and work in that mechanism, not just in a farm, hospital, whatever it is.
Any comments amongst yourselves to that?
The only thing I would add, I mean, I completely agree. One Health is about collaboration. It's about getting out of silos, and I think that absolutely needs funding and incentives. It also needs some attitudes of mind. I think it needs a certain amount of humility, an ability to listen to those from different sectors, an ability to sometimes put aside your preconceptions, whoever you happen to be, and realise there are other ways of looking at the world, and to do that in a way that actually builds trust and respect for the different things, different views that people bring, whether they're very senior policymakers, scientists, farmers, citizens, or others.
Just unsurprisingly, because I started out with every animal's attached to a person.
Yeah, exactly.
Absolutely, you've got to do that.
Yeah.
Just to remind people, though, that there's also a whole sector that nobody knows much about, and that's the wild animal markets in Africa. Yeah. And they need really to have better attention, and that's an education issue, that's a behavior issue, because that's the best you can do. You can't regulate those markets at present. But certainly getting the message through to communities about the dangers in animals will hopefully prevent the emergence of new pathogens or reemergence of pathogens in sub-Saharan Africa.
Excellent. Well, now it's time for our second Q&A session. One question, second question. So, Rajiv, please.
Thank you very much. My name is Rajiv Dasgupta. I'm a professor of public health in India and part of the hub, and I lead the policy dimensions there. Now, as we know that currently, or at any point of time, whether globally or nationally, there are multiple crises at any point in time. My question really is that what are your thoughts on how learning from one crisis can help address or alleviate the polycrisis that face us? Thank you.
I'm happy to kick off.
Yeah.
No, it's a really important question, and I don't think the commensal pathogens and other bugs that we're living with aren't the same as they were even 10 years ago, are they? I mean, we're living in a heated planet and so on. There's kind of, all those kind of, these polycrises are clearly interrelated and are amplifying one another. I mean, take particular examples. There was some work down in Bangalore, for example, looking at poultry farmers, new poultry farmers. A lot of the farmers had come away from arable because it was just no longer possible. They moved into poultry. They were getting quite a lot of infectious diseases. So they were, encouraged to put the chickens inside, which led to more air conditioning, then more antimicrobial use because the chickens were getting more and more heat stress. I mean, it's a really good example of an intersectional problem that you don't solve by just looking at the pathogen problem. You actually think seriously about what kind of food production and how's that going to work in that particular situation. So my sense is that, and just work I've done in Bangladesh, where it's really clear that unless you take livelihood security, along with food security, along with climate security in a monsoon environment, all those things together, you're not going to get good solutions. If you just focus on reducing pathogen, in my example from aquaculture, farmers are going to have their livelihood risks just go up like this because they're asked to farm in a particular way. So it's clear to me that you need that intersectional approach. And it, again, probably starts from the community, really, in order to assess what are the key issues, what are the threats they face, how are they going to co-create a set of solutions that work well for them.
Yeah, I would also just add that across all crises and their intersections, I think there are two other things that are really important. One is resilience, and actually to be able to build capacities, not just to respond to shocks and stresses, but actually to be in a position to head them off. And that often means having multiple opportunities, not kind of putting all your eggs in one basket, of this is a poultry metaphor, but for a single type of crisis, to be able to have different options to choose between them and to build some flexibility into the systems that you're dealing with. And that also relates to the other feature, I think, that we've seen of all these crisis areas, whether it's pandemics or climate or food crises, which is that they're very uncertain. And I think that we often tend, as scientists and policymakers, to think that it's all about risk. If we can just identify the risks, then we can mitigate against them, head them off, or insure against them. Whereas actually a lot of what we're dealing with in our multiple intersecting crises is real uncertainties where you can't calculate the probabilities, or there are things that are unpredictable. There are surprises around the corner. We don't know what we don't know. And in those circumstances, I think you really need to be aware of approaches that are learning by doing and are adaptive and are prepared to kind of turn corners and shift direction as something changes. So I think resilience, uncertainty, and they're a kind of duo, because resilience is partly a helpful response to uncertainty, are common to all crises.
Excellent question. Fabulous answers. Let's move on. Krishma, would you?
Hello. Hi, I'm Karishma, Research Fellow at Chatham House. I would like to thank everybody for the presentations and this lovely discussion that we've been having. So one of my questions have been, there's been a lot of discussion on community involvement. But how far is this community involved in these kind of discussions? Like most of these discussions we are having are among researchers or at academic level. And my question is, how well is the civil society involved? How well is the community involved? And how many of them are raising this as an issue? Because if one of the work that we had done was looking into the challenges to political commitment for financing health. And this was specifically in the HIV case, where we identified that unless there's a civil movement asking for something, nobody is going to be giving any funds for it. So how involved is the community and the civil society in raising this issue and seeing that there is a solution for it?
Thank you. Fabulous question and really fundamental, and I think was touched on. Please.
I mean, I can jump in there quickly. I think one point is that communities are often involved in these discussions, but they don't necessarily are in positions to speak their truths to power, and they often wouldn't necessarily frame their discussions in exactly the terms of science and policy to enable that to happen. But that doesn't mean that we shouldn't be looking for opportunities to learn from and draw them in. And just two really quick examples. My ex-IDS colleague, no, he's still there, I'm not there anymore, Ian Scoons, has just completed a really interesting project on pastoralists and uncertainty, and has shown that across the world, people who herd animals have learned about living with uncertainties of climate, of economy, of health, and have ways of conceptualizing those things, talking about them, responding to them in practical ways. And there's an enormous amount for them to teach planners of pandemic response, people doing disease surveillance, people doing economic planning, financial planning. And yet one needs to find some quite creative ways to link up those perspectives with, as it were, global debates. And some of the opportunities in that project have involved deliberative dialogues in countries, and also some quite novel things like translating scientific findings into comic books and comic strips, which actually portray in a very vivid way what's going on and the perspectives of pastoralists up to others. Another example would be my IDS colleagues and I established something called the Social Science in Humanitarian Action Platform, which was a response to humanitarian emergencies linked to crises of pandemics and of climate and health and so on. And that involved enabling community perspectives as identified and, as it were, translated and scaled up by researchers and local institutions and NGO workers based in particular countries, so very, very close to community, to be able to kind of collect and gather in response to questions on demand from policymakers, to bring that kind of social and cultural intelligence into shaping responses and making them more effective and socially attuned. And there have been quite a lot of examples which have touched on One Health issues in that context. The whole approach emerged out of the Ebola crisis in West Africa, where the response went so badly wrong because communities were not listened to. But I think it again provides a model. So I think we need to get creative about enabling community perspectives to be properly listened to and to come to be influential in policy action.
I think that's, there's not much more I can add. I'm trying to think of, are there kind of de novo or grassroots communities doing it for themselves around these issues? And I'm struggling to think of anyone, but anytime I've been in the field, it's quite an open door to push at. You know, when we've been in the field with FAO and doing a kind of a rural appraisal on Newcastle disease and so on, their instant reaction, because of the lack of capacity of veterinary skills in the country and no real way of improving that, is to identify usually a young woman in the community who will be the kind of link person to the Ministry for Livestock there, and you start to build up a kind of community expertise, and we've mapped there where the disease started, where it ended up. It's often that, you know, someone's chucked a chicken in the river and lo and behold, the ones downstream start getting the disease and so on. And then they start training people up so they can take some samples and so on and get that on a moped to the local lab and those kind of things. So that's where I think instantly you can see there's an appetite for doing something as a community and working as a community, and it's quite an easy door to push at, I think.
Maybe, Robyn, I'll come back to Emma's question on governance, because I think one of the things that's lacking in the climate change treaty negotiations is the voice of One Health. And it's really, there are so many good examples of how environment is important in food animals, for example, thinking of East Africa and Rift Valley fever. I think you all probably remember the 1999 outbreak of Rift Valley fever in southern Sudan, northern Kenya, when there was an El Nino event, flooding, closer proximity of cattle and humans, unvaccinated cattle, and increase in mosquitoes. All those things together caused a major Rift Valley fever outbreak that then went across the Red Sea with trade for food and other animals into Saudi Arabia and Yemen. So I think that, coming back to the governance issue, One Health has to have a better voice in the climate change as well, negotiations as well, and there are some great examples.
Yeah. Thank you. We have time for one last question. Yes, please.
Hi, thank you. Lucy Brunton, epidemiologist at the Royal Veterinary College. So my question sort of relates, I suppose, to leadership and responsibility for One Health, and I'm thinking specifically from AMR because that's something I'm particularly interested in. And I've been reflecting while you've been talking about some of the sessions we run with our students. So I run a session with our veterinary students as well as some students at LSHTM, thinking about interdisciplinarity and responsibility for AMR in agriculture. And the students have to think from the perspectives of different stakeholders, and at the end of the session, they have to say who they think should be responsible and paying for dealing with AMR in agriculture. And they always say government. Government should be leading, government should be responsible for this. And so I'm sort of thinking there is this perceived need for that senior leadership. And I fully agree with all of the comments today about the importance of communities and these bottom-up approaches. But I guess I'm just wondering, how realistic is it for communities to take this leadership role, and what, you know, how much does it have to be led by government? And then in that case, who's leading it? Which departments are leading it? Because we want to have these One Health coordinating committees across spanning, you know, different government departments, but does there need to be some core leadership with that?
So I think government space is doing the thing that no one else can do, but government can, that makes the difference. So sometimes it's regulation, because you need everybody to take action or you won't achieve eradication, for example. But it's not designing the disease control programs necessarily, because those, I don't think there are other people better able to do that, and you've got to have that understanding on the ground. So I think there's this balance in it, and that's why co-design, and it can mean different things to different people, but I think that is why that is so important. So you've got to have the community voice in there, and that leadership is part of it, but there will be things to get the final end goal that everybody wants that they can't do alone, so you've got to do it together. On the departments, it's a difficult one. In the end of the day, so people will have the best intentions of working joined up One Health. as we see, a good example maybe is the Fleming Fund, which comes out of Department of Health from AMR, and it's been very good in supporting animal health related AMR projects because it's realised that, but the governance and everything for that funding sits in the Department of Health, because that's how the structure of government and treasury funding and spending reviews and things works. And that's why I made a point about funding systems rather than necessarily the department silos and things that we have. But you've got to do government accounting somehow, and ministers have to be responsible for what's spent in their department. And the more you split it up, the more people you have involved in a decision, and the harder it is to get to a decision, and it takes much longer. And then you need more officials, and government gets bigger and bigger. So there's not a bit. The co-design for me, and having that evidence that then to get ministers, whichever department, to make the decision, because you've got such strong evidence, is really important.
Thanks so much. It's been a really rich discussion. We have maybe time for David to make a comment, and then...
I was just going to say there's a good concrete example of government and community links in the POD project, which was done out in Chiang Mai in Thailand. This was a project where animal raisers or farmers were given an app on their mobile telephone which reported when there was a problem in their animals, in their animal raising areas. And they would report this locally. There would be an attempt to diagnose locally and then regionally, and there would be an immediate response locally and regionally, and then the government would come in and provide what was necessary in the long term. So new technologies, especially digital technologies, have opened up a whole new way of working from communities up to government and from government back to communities. I think a good example in the UK is the flu survey, which was conducted by London School for a while, where participants from communities actually reported influenza symptoms and signs and then got information back as to what to do.
Last word from Steve, and then finally Melissa, if you'd like a last few words.
Lucy, that's a really good question and a good bit of teaching. It just reminded me, I was at the Food Standards Agency for a little while, some years back, and I remember a new director coming in who said, how do we regulate this without any money or power? And the answer was Tesco's. And in some ways, the AMR strategy in the UK has been led by the food assurances, about the British Poultry Council and so on, have been quite effective in some ways. I have my own problems with that form of regulation, but nonetheless, that's kind of interesting. And I think you have to, again, it's about the context and thinking about where are the levers, where is the power in a so-called community, and how does that work? And in some ways, companies like Tesco's and all the other supermarkets kind of invent a public to come. They know that people aren't that interested yet in AMR, but they're frightened to death of it becoming an issue, and they've not been doing anything. So there's a kind of issue there about how power works in a regulatory environment and what a government can do to just nudge things. I wish I'd never used that word. Sorry. You have permission to shoot me at that moment, right?
This is by no means the last word, but just two things to build on. I think there's probably a lot of scope for learning across countries about these governance approaches, and the UK could learn from some of what's going on in these Asian countries in this hub and so on, and maybe a future kind of requirement for ongoing work is to look quite explicitly at governance systems and at policy systems, and maybe that's where we should be pushing some of this funding to move towards. Recognising that it's about how things work differently in different national jurisdictions, but also about how those different country contexts and their policymakers and regulators are positioned both in global economies and with respect to their consumers. So I think one message for the future coming out of this hub's work is I think it's been a really great example of cross-country learning, and let's have more of it into the future. My other just point was that I think for all the talk about collaboration, there's always a danger of things that are intersectoral, interdisciplinary, into everything, be kind of turning into either a kind of lowest common denominator squodge or a tick box exercise. And I think there are also dangers in just saying, okay, we'll have One Health comes to be everything, and then it's nothing. And I see that happening a little bit too. So I think somehow there's the knack is to keep the sharpness of debate, to keep the tensions alive, to realise that different stakeholders have different views and values and different pressures on them, but to enable them to work together in quite honest ways to move forward and recognise where the goals are shared.
Thank you so much for your time and for your willingness to share your wisdom and to really help point us in the direction where we can make positive change, given that we're in a world with polycrises. So please join with me in thanking our panellists.
So I'd like to add my deepest thanks to all of our panellists and to our moderator for what to me was an incredibly stimulating and interesting discussion. I have the probably near impossible job of attempting to summarise that discussion in around 60 seconds. For me, it was quite an eye-opener. I don't work directly in the field of One Health. I'm a bit more of a technical geek for one of the disciplines that's used in the One Health project. So seeing the bigger picture was an eye-opener for me. One of the key concepts that came out to me was this idea of institutionalization. Now, maybe that's commonly discussed in One Health field, but it's clearly a paradigm, a concept that's working so well on an intellectual level, and projects like the Poultry Hub show the truth of that, and all of the anecdotes that we heard today demonstrate that One Health is real. And it can make this fundamental difference. But then how do we translate that intellectual concept into something in the real world? And that means money, and it means power. So the really difficult question is, how is that money and power organised and arranged to make One Health happen in the real world? And then I thought there was a really interesting distinction between some of the really cutting-edge science that's being used to understand, in this case, how pathogens are flowing through economic and social systems. And one of those technologies is something that I've worked on, which is the analysis of pathogen gene sequence data. But then so that gives us the understanding we need to sort of to see how pathogens are moving, what's determining pathogen transmission and the risks to humans. But then the responses to that, the robust ones that we heard about, are fundamentally non-technical. That it's about education, it's about bottom-up approaches from communities coming together and understanding to sort of self-empowering them to solve their problems rather than it being imposed from the top down. So I found that an interesting distinction between the technical observation and understanding a system and a non-technical solution to the problems. Of course, the panel started off in the best possible way by us all hearing that vets are the ones that get this right and the medics get it wrong. So I'm going to leave on that note. Thank you so much again to all of our fantastic panellists and to our moderator. Thank you.
So, colleagues, it just leaves to me, do you know what's been really nice tonight? I've taken off my principal's gown and been able to put my epi hat back on again. And funny enough, earlier this afternoon, I was doing a bit to camera for the Royal Society of Biology, who were here to ask what we meant by One Health. And if I'd only known. Just come with me for a couple of hours. It's funny, though, in my sort of cat-handed way trying to explain it as I saw it, the producer who was sitting there asking the questions in a very kind of like zen and laid-back fashion, he goes, what, you mean like the way indigenous people treat their animals and their environment? I'm going, something in that. And I think the other thing to remember is that, that of us are old enough to have been using the One Health term for an awful long time. And it isn't new anymore. But the concept is even older. And if you go back over 100 years to, I know where at least the CVO spent some of, not 100 years ago, Christine, but in Glasgow, the TB trials in Glasgow, the conclusion of the TB, it doesn't matter what it was about carcasses, contaminated carcasses. But the ruling was that the judge said, and it is now for the two branches of the medical profession, human medicine and veterinary medicine, to get it sorted out. So there's a little something in that. Two other reflections personally. Somebody asked, why haven't we made greater progress than we have, already? And there's two rules in politics. The first rule is get re-elected. The second rule is don't forget rule one. And so my dad always said to me, son, you've got to remember, if you're going to back a winner, back self-interest every time. And I think it's finding those levers where the politicians can actually see that there's something in it for them, in the same way as corporations need to find something in it for them, which will be profit. The politicians need to find something that makes it relevant to them. And if you wonder why we haven't done enough on rabies and we haven't done enough on Zika, it's because it doesn't affect the populations that we are generally interacting with. They have to be able to see it affecting them. And it's a funny corollary of that is that you'd perhaps like to think that with some of the epidemics and pandemics we've been faced with in recent times, they might see that actually taking the fighting disease at its origins, to bring you back to our Latin motto, might be something we need to rediscover. Finally, I suppose, I think sometimes we give the corporations a bit of a bashing, and Stephen, you used the Tesco model. There are other supermarkets available, just to be clear. But similarly, if you look at the Cargills or international burger chains, I mean, they can make decisions about antimicrobial usage that apply in many countries overnight, where no national government could do it, no WHO could do that. So those levers that we have are relatively few, and we've got to be careful that we identify them. And similarly, if we addressed obesity, for example, we'd probably take care of a whole bunch of other problems, hypertension, cancer, cardiac disease, probably arthritis, diabetes. Similarly, for what we've been talking about tonight, if we got poverty and sanitation sorted out, we'd probably take a lot of the issues that we've collectively been able to demonstrate evidence of this evening, at least a step forward. So, to add to Ollie's thanks, thank you to all our speakers, thank you to our panel, fantastic work, but a particular thank you to everybody who's done the work, those who funded it, and if there's a little example of One Health I can leave you with tonight, it's, and I know Fiona would hate me for saying this, but she was recognised by the Royal College of Veterinary Surgeons with the Plowright Award, which is a sum of money that she is reinvesting in the sponsoring of and training of young researchers around the world. So a veterinary organisation recognising a non-veterinarian, I think maybe just a little example there. But to Fiona and all of you, thank you so much. Why don't we now go and have some drinks outside, some drinks and some food. Thank you very much indeed. Thank you.